Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenters are Luanne Sadueste and Dr. Jack Rose. Luanne Sadueste has certifications being a neuroscience registered nurse, critical care registered nurse, stroke certified registered nurse, as well as being a certified diabetes educator. Dr. Rose is a neurointensivist and is board certified in neurology as well as vascular neurology. Dr. Rose is co-medical director of the stroke program.
Hello, good morning everyone. I'm Luanne, diabetes educator. Dr. Rose and I are going to be talking about diabetes and stroke. What is the connection? But what is a stroke? It can be a little bit confusing because there's different names for a stroke. The fancy medical terminology for a stroke is cerebrovascular accident. You might also hear ischemic stroke or cerebral infarct. My favorite name for a stroke, and only because it makes the most sense, is a brain attack. Much like a heart attack, a brain attack is an emergency. They all pretty much mean the same thing, which is a sudden death of brain cells in a localized area due to inadequate blood flow. Now let's see what that looks like. The first picture shows blood flow going to the brain. The second picture shows blockage, usually from fatty deposits from atherosclerosis. You can even see a clot there. Either way, they are blocking the blood flow going to the brain. Now no, without blood supplying oxygen and nutrients to the brain cells die. Now, depending on what region of the brain is affected, it can leave permanent damage like paralysis or speech impairment. So the most important thing is to prevent the blockage, the narrowing, or the clot from happening in the first place. And you can do that with blood sugar control. The American Diabetes Association says that people with a A1C above goal, above 7%, is nearly 3 times likely to have a stroke. Stroke kills about 140,000 Americans each year. Every 40 seconds, someone in America has a stroke. Every year, more than 795,000 people in the United States has a stroke. Now, stroke is the 5th leading cause of death, but it is the #1 leading cause of serious long-term disability. And this is very expensive. It costs the United States an estimated $34 billion each year. A majority of the strokes are ischemic strokes. About 87% of the time it's an ischemic stroke in which blood flow to the brain is blocked. Now, who is at risk for having a stroke? You can see those with high blood pressure, those who smoke, uncontrolled diabetes, following unhealthy diet, being physically inactive, obese, high blood cholesterol, peripheral artery disease, carotid artery disease, atrial fibrillation, which is basically an irregular heartbeat, or sickle cell disease. Either way, 80% of the time, a stroke is preventable. 20% you can't control. You can't choose your age, you can't choose your parents, But you can modify your lifestyle. You can do that by controlling your blood sugars. You can do that by controlling your blood pressure. If you smoke, you have to stop smoking. So those are controllable. Those are modifiable. So remember, 80% of strokes, 80% of the time you can prevent yourself from having a stroke. Now there's different types of strokes. Majority of the time, 87% of the time, it's due to a clot. It's called an ischemic stroke. They even have a bleeding stroke called a hemorrhagic stroke. This is usually caused by a rupture in a blood vessel, usually caused by a ruptured aneurysm or arteriovenous malformation. Those types of strokes are from uncontrolled high blood pressure. Now they even have this other term for a stroke called transient ischemic attack, also called a mini stroke. This is when the clot is there and it causes symptoms and the blood clot goes away, so blood flow is restored, the symptoms go away. Now there's nothing mini about this. This is very serious. It's actually a sign of an impending stroke. It needs medical attention right away. If blood flow is not going to that area, that part of the body won't work anymore. So for example, if blood flow is blocked going to the posterior area that controls your vision, you're gonna have trouble seeing in one or both eyes. You might also have trouble walking, trouble with balance. If blood flow is blocked going to the area that controls your language, you're gonna have trouble speaking, trouble talking. If blood flow is blocked going to the area that controls your face, arm, or leg, you're gonna have weakness to that part of the body. So it really depends on which part of the brain is not getting enough blood flow. So this picture shows blood flow going to the brain. Now it's blocked. Know that when someone suffers from a stroke, 1.9 million nerve cells die each minute. So that's why, hence the term time is brain. It's an emergency. It's a brain attack. You need to call 911 right away. Very critical. Now, organizations have come up with acronyms so that we can help the public recognize when it's the time to call 911 because somebody's having a stroke. It used to just be FAST, but now they've expanded it to incorporate the balance issues for B, and E is for eyesight loss. They've kept the F for facial drooping. You would ask the patient or your loved one to smile, and if they're having asymmetry to their face, that could be a sign of a stroke. If they're having weakness, either the left or right arm, that could be a sign of a stroke. Speech difficulty is the S, and any of these symptoms is time to call 911. Now we could further investigate what are all the 10 signs and symptoms that may indicate a stroke. It's basically anything that happens all of a sudden. All of a sudden, if you notice your loved one is confused, can't think correctly, they have this kind of puzzled look in their face, that could indicate a stroke. If they're having problems understanding, unable to comprehend speech or language, that can be a sign and symptom of a stroke. Any sudden dizziness, lightheadedness, motion sickness, that can also indicate a stroke. Loss of balance, less coordination, also numbness, tingling, feeling like pins and needles, especially the face, arm, or leg, and especially on one side of the body, that could definitely indicate a stroke. Any sudden, severe, unusual headache actually could be a sign and symptom of a bleeding stroke. So if it happens all of a sudden, it's their worst, they often describe it as the worst headache of their life. That could also indicate a stroke. Again, trouble speaking, trouble talking, trouble walking, less coordination, trouble seeing in one or both eyes, or having weakness. Again, weakness, either the face, arm, or leg, and especially on one side of the body, are indications of stroke. And especially if they happen all of a sudden, that is the time to call 911. It's okay to overreact, okay? It's very important to get medical attention right away because time is brain. You can see it could be a little bit similar to low blood sugars. That's why I always ask my patients, whenever they don't feel right, check your blood sugar, right? If you have this sudden dizziness, lightheadedness, numbness, tingling, check your blood sugar. When you do go into the ER, if they do rule you out for a stroke, guess what they're gonna do? Just check your blood sugar. Make sure you're not having a hypoglycemic event. Now, there's different treatments for a stroke. If you are having a stroke, it's very critical to receive medical attention right away. Immediate treatment can minimize the long-term effects of a stroke and even prevent death. If you do qualify for this FDA-approved medication called TPA, it's a gold standard clot-busting medication, but it could only be given to a certain amount of, or certain patient criteria, and the most important criteria is time, when that patient was last seen normal, or when that person was last seen normal.
I'm going to continue the talk where Luanne left off. I'll start off with a quick joke. So a diabetic patient walks into a bakery and talks to the clerk behind the counter and says, "Hey, I'm a diabetic patient. What here is safe for me to eat?" And the clerk looks at him and says, "Everything. It's just as long as you don't put it in your mouth." But seriously, Luanne did a fantastic job of giving you guys an overview or a review about what stroke is. And one of the things I really want you to remember and to take to heart is that stroke is very preventable, like she said, but it's also treatable nowadays. So one of the treatments that we have if someone comes in very shortly after having a stroke is this TPA medicine. It's a clot dissolving medicine. But like Luanne was mentioning, we have a very short time window for when you can give this medicine. It has to be given very carefully in an IV in an emergency department, and it can only be safely given up to 4.5 hours after the symptoms began, or 4.5 hours after the symptoms started. So only a small percentage of people that are experiencing a blocked artery stroke will qualify, but if you are experiencing an ischemic stroke, a blocked artery stroke, and get to the hospital within that time frame, receiving this medicine will give you a much better chance of having a better outcome in terms of minimizing the kind of disability you might have to face months and years down the road. Other times we can get strokes or warning signs of a stroke from a narrowed or partially blocked neck artery. You may have heard that you have a number of arteries in your neck. The two large front ones are called your carotid arteries. Those sometimes over the years can, especially in people that have high blood pressure or diabetes or high cholesterol, the blood vessel walls can get diseased and they can get narrowed, and that can cause insufficient blood flow to one side of the brain. And if you have a stroke that's mild or a warning sign of a stroke and we think that it's due to a narrowed neck artery, we not only give you medicines to reverse or protect the artery from getting more disease, we can sometimes recommend a surgery, either an open surgery where a vascular surgeon would go in and clean out the blockage. It's called a CEA, or a carotid endarterectomy. Or some patients can have an alternative procedure where they do a catheter procedure. They put a catheter into the artery and open up the blockage from inside the blood vessel. Both of those options are available here at Washington Hospital, and or some people may qualify for those treatments. Diabetes doesn't only just cause stroke, and obviously your eyes can get affected from diabetes, called retinopathy. Your kidneys can get disease from that. It's called nephropathy. You can get peripheral vascular disease. You can get blockage of limb arteries. That can lead to ulcers and loss of limbs from amputation. Heart disease, heart artery disease can be contributed from diabetes, and people can have heart failure related to diabetes. But stroke is the topic that we're talking about today. The only way that we know whether it's a blocked artery stroke, which it is 80 to 90% of the time, versus a bleeding stroke, is by taking a picture. And oftentimes that means we take a special x-ray picture of the head whenever we see somebody in the emergency room that we're worried about a stroke. So it's called a CAT scan or a CT scan. And on the CT scans, bleeding strokes will look like bright white areas inside of normal gray tissue. Blocked artery areas will look dark. So this is an example of a patient that had a big blocked artery on this side of their brain, and it led to a big stroke. And actually this person had to have a life-saving surgery where they took off part of the skull because the stroke was so big it was going to swell and slowly squash the rest of their brain, and they were not going to survive if that emergency surgery was done. This does not happen very often, but sometimes it does. And strokes, both bleeding or blocked artery, can affect any parts of the brain, and the symptoms are related to what the parts that the brain does in that area. So why do diabetic patients get stroke? Why are diabetic patients at increased risk for stroke? There are direct reasons, and then there are indirect reasons. There are three main direct reasons why patients with diabetes get a stroke. Well, the first is something that in medicine we call endothelial dysfunction. Endothelium is just a medical term for the cells that line the arteries in your body, and they have a very, very important role in regulating blood flow and the tone and the reaction of the blood vessels to normal day life. So you're related to how your blood pressure changes, other changes in the arteries. The endothelial need to be healthy in order to give the factors and to allow normal blood flow through them. And so people with diabetes, the endothelium gets unhealthy and doesn't work as well. The arteries also in diabetes can get abnormally stiff, so they can get extra stiff, and it can be in very small arteries or large arteries. And also diabetics, your blood sugar is chronically high, it triggers higher levels of inflammation, either throughout your body or in particular areas of the body. And the inflammation plus the stiffness together, that leads to this medical condition that we call atherosclerosis, which is sort of hardening of the artery and artery disease that can give you a heart attack or a blocked artery stroke. So this is just a diagram showing you what I just mentioned. If you have diabetes, it can cause the endothelium to not function well, the arteries to get stiff, your body can get and your vessels can get inflamed, and that can cause this artery disease called atherosclerosis. Now, there are also indirect reasons why diabetic patients get stroke, meaning that patients with diabetes are at an increased risk for having high blood pressure, high cholesterol, metabolic derangements, autonomic problems, and or heart failure, and all of these factors can contribute directly or indirectly to stroke. Luanne mentioned this earlier, that if you happen to have diabetes, especially if it's not well controlled, it significantly increases your risk for a stroke. How much does it increase your risk? Well, depending on what study you look at, it can be anywhere from 1.5 times the stroke risk to up to 6 times the risk of stroke. It's actually very high for people that have type 1 diabetes, which is most often found in young patients if they have diagnosed with diabetes. But that doesn't mean that type 2 diabetics don't have an increased risk for a stroke. If you just happen to have type 1 diabetes, your stroke risk is significantly higher. And unlike other people, in terms of the risk of stroke in general in the general population, age is a big risk factor. Stroke tends to be a disease that affects older people rather than younger people, at least blocked artery strokes. However, if you happen to have diabetes, just because you're young, it doesn't mean you're protected against stroke. Young patients with diabetes are more likely to have a stroke than young patients without diabetes. And interestingly, people that have pre-diabetes, they don't quite meet criteria for a diabetes, but they're insulin resistant or they're approaching the diagnosis of diabetes are found to have increased risk for stroke as well. And again, we talked about the indirect and direct factors for this. The hyperglycemia damages the blood vessels like the endothelium and makes them extra stiff, and also the diabetic patients are at more risk for other risk factors for stroke like obesity, hypertension, and hypercholesterolemia, etc. It turns out that diabetes not only increases your risk for blocked artery strokes, but it increases your risk for bleeding strokes or hemorrhagic strokes. It's much more common that diabetes patients will experience ischemic strokes, but you also have an increased risk for bleeding strokes as well. And then in terms of what types of strokes do people with diabetes might they suffer? It's actually, you can get a stroke from a blockage of a very small artery or a big artery, like a big neck artery or a big brain artery. But one of the hallmarks of patients with diabetes that have stroke is that sometimes the vessel is so small, we can't even see the vessel when we do a high quality picture test of the brain, but yet we can see the stroke, the damage that happened from it. So even very small arteries that can get blocked can cause a stroke and can be disabling. But like Luanne mentioned, diabetes is a modifiable risk factor for stroke, and by controlling your diabetes, you can really drive down your risk for ever having a stroke, okay? So that's really the good news. This is just a slide, and I don't want you to look at all the details. It's just showing you a number of different studies listed down here, looking at people's risk for having strokes if they happen to have diabetes, both blocked artery strokes, and if you're a man or a woman, here's a bleeding stroke, and then all stroke together. And it shows you that depending on what study you look at, the risk of having a stroke if you happen to have diabetes is anywhere from, on average, about 10% greater to about 70% greater risk, okay? And men and women tend to be equally affected in terms of the diabetic risk for causing stroke. And then stroke treatment. What happens if you happen to have a stroke? What happens to the blood sugar in your body? It turns out that even if you don't have diabetes, but you're having a stroke and you come into the emergency room and we check your blood sugar level, having a stroke causes a stress response in the body and it raises your blood sugar level, okay? Even if you don't have diabetes, in both blocked artery strokes and bleeding strokes, okay? But remember, with diabetic patients, unless they're extremely well treated, your baseline blood sugar is going to be higher than normal. So then you add a stroke to that, what happens to your blood sugar? It can go really, really, really high, okay? So having very marked high blood sugar levels when you're having a stroke, if you're a diabetic, is almost the rule. It's not uncommon at all, okay? And why am I mentioning this? It's not just an interesting, fact. It turns out that the higher your blood glucose is when you come in with a stroke, the higher your chance of having a poor outcome, okay? So it's been looked at and studied, and this is what we call an independent risk factor. If you take everything else in control for it, if the higher your blood sugar is when you come in with a stroke, the higher your chance of not having a good outcome, okay? And also, if you have a very high blood sugar level when you come into the emergency room, but yet you qualify for TPA, having a very high blood sugar level gives you a higher chance for having a bad side effect that fortunately only affects a small percentage of people that we treat with this medicine, and that is bleeding in the brain from the medicine. It's a clot dissolving medicine, but the problem is sometimes if you rapidly restore blood flow to a severely damaged area of the brain, that damaged area of the brain can have bleeding into it. Now, this happens only like 1 to 2% of the time we give this drug, fortunately. But if you happen to have really, really high blood sugar, that's one of the strongest risks for you to have bleeding from the TPA. So it does matter what your blood sugar is when you're coming in with a stroke. And this is one of the reasons if you happen to have diabetes, to really aggressively control your sugars so that should you, God forbid, ever have a stroke in the future, your blood sugar is not going to be sky high when you come in. What about if people's blood sugars is really high after having a stroke? Should we, as physicians and nurses, should we really drive down the sugar to a very, very low level to try to maximize patients' recovery or minimize their risks of having a bad side effect? Well, they've actually studied this in a number of trials, and there's one study that I just want to highlight because it was just published within the year, and it was called the SHINE trial. It was a randomized trial, meaning that if people came in to the hospital with a stroke, with high blood sugars, that they took half of the group and they drove their blood sugars down very aggressively low versus just doing the standard therapy, which is making sure it's not extremely high. So they studied people and either gave them intensive blood sugar control versus standard. And the way they did that was the intensive group, they gave them a continuous infusion of insulin in the IV versus sliding scale insulin where they would check your blood sugar and then give you a subcutaneous injection of insulin depending on the level of your blood sugar. And so they randomized this study over 1,100 patients with blocked artery strokes. They did this study over 6 years, and they published it this past summer. And if you looked at the intensive management group versus the standard group, the intensive group, their average blood sugar is about 120. Now remember, these are patients that just had a stroke, okay? So getting their sugar down to 120 required aggressive therapy. As opposed to the standard group, their average blood sugar was about 180. And then they looked at their brain outcome, how well they recovered from their stroke. And what they found was, even if the two groups were the same, the group with the intensive insulin use was 20% good, favorable outcome, and the standard group was 21%. But the people that got the aggressive therapy had a much higher chance of having significantly low blood sugars. And so the conclusion of this study was that, yes, we recognize that high blood sugar is an issue in patients coming in with stroke, especially if they have diabetes, but that aggressively lowering it to sort of a normal level immediately doesn't help and might potentially cause some harm. And actually, that's been the finding we've had for other medical critical illness patients in our intensive care units. We follow their glucoses carefully, but tend to not really rapidly lower their blood sugar. There's something to the body's stress response that you don't want to mess up too much. But some additional good news for you. You know, I've been talking about stroke treatments and that stroke is treatable, but it's also preventable in diabetic patients. And there have been studies looking at how can we prevent a first stroke from happening in patients with diabetes, and then can we prevent a second stroke or a third stroke in people that have already had a stroke and they happen to have diabetes. Well, they've done studies showing that if you effectively or intensively control your blood sugars, it's associated with a 6-year risk reduction of 40 to 60%. Just by aggressive blood sugar control. Then if you control your blood pressure and you control your cholesterol level and you good diet and exercise, all these things that you do add together to really lower your risk of future stroke. Okay? It turns out that weight loss alone doesn't seem to benefit you so much, but if the weight loss is associated with better fitness, with better blood sugar control, with better blood pressure control, you will definitely lower your stroke risk. And in fact, we talk about multiple risk factor modification, and if they study people that do multiple ways of improving their health, like blood pressure control, diabetes, sugar control, cholesterol control, exercise, you can decrease your long-term stroke risk 70 to 90%, okay? So it is very preventable. And then what happens if you have a stroke and you happen to have diabetes? Can you prevent a next stroke? And it turns out that one of the strongest risk factors for having a stroke is having had a previous stroke. And so we don't just focus on preventing the first stroke, we also never want a person to have more than one. And we also have good evidence that if you study use of medicines like strong blood thinning medicines, there are medicines that affect the small parts of your blood called the platelets. Those are little particles in the blood that cause sticky blood clots to get bigger and cause problems. If we give patients strong blood thinning medicines right after they've had a stroke, especially sometimes we'll even use 2 medicines all at once for a short period of time, it significantly decreases your chance of having a second or third stroke. And those are some recent trials that were done to show us the benefit. And also, I just wanted to mention one of the drugs that Dr. Cotta mentioned earlier, one of these insulin sensitizing drugs, was also studied in people that didn't have diabetes but had pre-diabetes. And they came to medical attention with a stroke or a warning sign of a stroke, and then they gave half of the group this medicine, this glitazone medicine, and half a sugar pill, a placebo, and they found that the people that they gave this medicine to who happened to be pre-diabetic, it decreased their chance of having another stroke, and which is really important. So there are some medicines that act directly on your glucose levels in your body that can improve your risk for ever having a next stroke. Interestingly, that medicine also increases your chance of having some weight gain, and so you have to be aware of that, and that's called the IRIS trial. So we have a lot of resources for you to learn more about the connection between stroke and diabetes. Much of the talk that I prepared and showed you today came from a review article in the American Journal of Medical Science, and thank you very much.